I can keep doing as fast as y'all. This is the worst. This was the most, I say, heartbreaking piece of information I got written in this book. They talk about how there's racism in the healthcare system. And so you would ask, why do black Americans have the lowest or the shortest lifespan, especially black males? Again, is it that they just predisposed to not live as long, or does the healthcare system play a part? And this is what I mean. So they did research. I can't remember the school exactly. I believe it was a school in Baltimore with medical students. And so according to the research, the majority of medical students admit that they have an aversion towards black Americans, and that they would prefer not to, they're not even got their degrees yet. They're saying they would prefer to work with white patients in the future, white clients. Taking it even further, physicians that practice now also admit that they prefer to work with non-black patients because they don't feel that black people take their health and wellness seriously. And so the way what that is saying is this: that when a white American, for example, is seeing a black patient, he already has a natural aversion towards that black patient, and it makes sense. And this is another sad statistic. They also asked Asian and Hispanic physicians if they prefer, what race did they prefer to work with, and they all said white. So when you go into the hospital, like it or not, admit it or not, you're being stigmatized and discriminated against just in how doctors practice. And so there were 4 different types of behaviors that doctors practice when they're engaging with black clients. Yeah. And another stat as it relates to transplants. There's a section in the book. Black people they wait on an organ transplant list longer than white Americans. Even on, I haven't read this book in a while, but even with kidneys, there's more black people in America that need kidneys, but yet they're least likely to get one. And the ones that get one still have to wait longer than the white patients who are also on the kidney list. Black children who report similar levels of pain when they're in the emergency room, they get lower doses of pain medication in comparison to white children. This is a sad situation, but again, it makes sense. It's 325 million Americans. White Americans make up 62% of the population. That means there's 225 million white Americans. Out of those 225 million, 53% admit that they have an aversion towards black Americans, meaning they just don't mess with them. That's 115 million people. That means 115 million white Americans in this country that just don't necessarily like black people. All those 115 million people, they have the criminal justice system, the education system, the financial system, the healthcare system, all those systems. And I think we have this illusion that, even though this guy might be racist, once he puts on his uniform, his badge, he's not going to be racist. Once his doctor puts on that white coat, he doesn't take all of that bias with it. It's still in their heart. Same with the teachers. I still have low expectations for you.